Now, joining us live is Dr. Arindam Basu, Associate Professor of Epidemiology and Environmental Health at the University of Canterbury, New Zealand, joining us live from Christchurch. Thank you so much for bringing us on the broadcast here on WION World is One. Talk to us. New Zealand is seemingly the brightest spot in the world at the moment.
Yeah, hello. Yes, this is evening in New Zealand. Greetings from us. Yes, it is indeed true that we have kind of well on our way to ease the lockdown conditions. Now the lockdown conditions in New Zealand had a 4-level tier. So we have entered today the level 2, which is a significant reduction in the strict lockdown conditions. So more people can gather, the cafes can open, as you said, and up to 10 people can, accommodate, can go together and enjoy it, and most of the businesses are now open. So, yeah, so we are doing well in that sense.
And more importantly, there have been no new infected cases that have been reported in New Zealand in the last few days. That's 0 infections in New Zealand for days on end, at a time when other parts of the world are witnessing the arrival of a second wave.
Yes, actually there are three days in a row that we didn't really have any new cases. But it goes more than that, because what has happened is this, that we have about under 1,500 cases total, confirmed cases. We had 93% recovery rate in the country, and we have had some of the largest testing capacities, testing stats in the world. So we are around 45,000 tests per million population at the moment, and we are tracking around 130 plus tests per case, so which is one of the highest in the world at the moment. So those are the things that kind of work well for us, and so that's where we stand at the moment. Yeah.
Right, and in that sense, New Zealand also presents a model for the rest of the world in terms of the lockdown it imposed in the first place. It was considered one of the harshest in the world for a month-long nationwide lockdown, and it has somehow found a way to control infections and deaths and emerge out of it to as near normalcy as possible.
Well, it's not quite near normalcy, because you still need to understand that there are still quite a few restrictions and advisories are in place. People will need to maintain strict hand wash, social distancing, and maintain at least 3 meters it's like 3 feet and 1 meter distance in social circumstances, but 6 feet and 2 meters when they're transacting with other people in the supermarket. So there are those checks and balances in place, and the bars are not yet open. The bars are not going to open till next Thursday, I believe. But other places are kind of now opening up. The country is opening up, of course. So that's happening. So it's not really quite normal, but it's as normal as it gets under the circumstances. So that's something to keep in mind.
Right, and we've seen the mayor of Queensland do a bungee jump, and we've seen other senior Australian authorities welcoming the easing of restrictions, and more importantly pointing towards the need to revive tourism.
Yes, that's certainly something that's very important, and the government in today's budget has emphasized and earmarked money for tourism. But at the moment, because the international borders are still closed, the money for the boost in tourism will be mostly for the domestic travelers. But that's certainly something that's very, very important, because tourism is one of the major cash earners for the country. So that makes sense. Yep.
Right. And if you can tell us what it's like on a daily basis at this point in time, vis-a-vis you've been witnessing how the rest of the world is dealing with this pandemic at this point in time, how different it is really in New Zealand at the moment?
Well, at the moment in New Zealand, till about yesterday, because the real easing of the conditions started from today onwards, but till about yesterday, life was quite subdued. People, by and large, kind of collaborated with the government. They really did not go out in droves as you would otherwise have expected. People in New Zealand, we are we quite are fond of our outdoor games, and we are quite fond of sport activities, outdoors art. People kind of sacrifice those. And as a matter of fact, there were some interesting bits about how people were arranging themselves to get entertained in their backyards, that kind of stuff.
Right.
Almost everything was closed. There was no cafe, nothing for the So that's quite a restricted way of life that we've been leading for the last, I'd say, roughly 8 weeks now. 6 weeks, yeah.
All right, we will leave it at that.
It's a big relief for some.
All right then. Dr. Arindam Basu from the University of Canterbury joining us live on the broadcast. Thank you so much for sharing your views with us.